Hi, my name is Dr. Apazidis. I'm an orthopedic spine surgeon practicing at 57 and 7th Avenue in Manhattan, New York. One of the most important questions that we get is, what do I need to do before surgery and what can I expect after surgery? Fortunately, a lot of the things before surgery will be handled by my office and my surgical coordinators. There'll be a visit to your family doctor to get a medical clearance and make sure that we can administer the anesthesia and perform the surgery without any difficulty. Most of the procedures that I do have very minimal blood loss, if any. So we're not really too concerned about certain medical conditions that might have been a concern in the past. It's less of an issue at this time. Typically before surgery, I tell patients to kind of maybe prepare your home, maybe do some shopping so that you don't have to do some of these things after surgery. You will leave the hospital when you're prepared to leave the hospital and no sooner. We have certain criteria that we want to meet until you're ready to go home. When you go home, you'll be able to get in and out of a car, you'll be able to get in and out of bed, you'll be able to walk to the bathroom, you'll be able to walk to the kitchen and the living room without any great difficulty. Obviously, we'll be prescribing certain medications that will ease the symptoms in the first few days or first few weeks after a procedure. But fortunately, these symptoms do tend to be very minimal, and most patients don't have to take much pain medication at all after most of my procedures. In the first days to week or two after a procedure, patients will certainly be walking around their home, walking outside their home. I typically say you probably will want to be avoiding driving or trips to the supermarket in the first week or two after a spine procedure. But certainly by around 2 weeks, I think most patients are able to do most errands that they have to do or minimal kind of chores in the home. I tell people to avoid a lot of bending, lifting, and twisting in the first 2 weeks after a spine procedure, whether it's the neck or the lower back. Typically, patients have returned to driving and almost full activities by about 6 weeks after most of my procedures, whether it's the neck or the lower back. Many patients have returned to work even before that time, obviously with our understanding of what activities should continue to be avoided. We always say that the full recovery can take anywhere from 3 to 6 months, but that certainly does not mean that you're doing nothing for that period of time. It just means that certain precautions will have to be observed. Rarely, if ever, do my patients need to wear a brace, whether it's the neck or the back. Rarely, if ever, will they be strictly bedridden or unable to get up and take care of themselves. I really cannot think of the last patient that hasn't been able to go home, wash themselves, cook small meals for themselves, and really care for themselves independently. Many people are concerned that they have to have a lot of help at home or other people have to take time off of work to help them. I want to kind of assure people that that is very rarely the case. If a patient can't get themselves out of bed into the bathroom and walk at least 150 feet on their own, they're not going to leave the hospital. It's only when these criteria are met that I allow a patient to go home. And fortunately, most patients do meet these criteria within a day or two after most of the procedures that I perform. To find out more about orthopedic spine surgery or to seek a consultation, please go to my website, www.totalspineandsportscare.com.